Today, we're going to talk about something that honestly sounds like no big deal, but it hides a really dangerous secret. We're talking about the human bite.
So let me ask you something. When you think about bites that actually send someone to the ER, what pops into your head? Yeah, dogs, for sure. Cats, probably. But what do you think lands in the number 3 spot?
Believe it or not, it's human bites. Medical data shows they are right up there, just behind dogs and cats. They actually make up a pretty big chunk of all the bite injuries that hospitals have to treat.
But here's the thing. Not all human bites are the same. We're going to zero in on one specific kind that usually just looks like a tiny cut on your hand, but is actually a ticking time bomb for a really nasty infection. It's called the fight bite.
So how in the world does a small scrape on a knuckle turn into a full-blown medical emergency? Well, it's all about this unique and frankly kind of scary way the injury traps bacteria inside.
Okay, so here's how it all goes down. This isn't a bite like you'd normally think of it. It happens when someone throws a punch, and their clenched knuckle smacks into someone else's tooth. That tooth basically acts like a tiny, dirty needle. It doesn't just break the skin, it goes deeper and punctures the little capsule that surrounds the knuckle joint. And in that moment, it injects a whole bunch of mouth bacteria directly into that joint space. Then, and this is the crucial part, as the person unclenches their fist, the skin and the tendons slide right back over that tiny hole, sealing all that nasty bacteria inside. It's literally a perfect trapdoor.
And we're not just talking about one type of germ here. The human mouth is a zoo of different microorganisms. So the infection you get is polymicrobial, which is just a fancy way of saying it's a dangerous cocktail of different kinds of bacteria all working together. And that's what makes it so aggressive and so tough to treat.
So, who are the actual bad guys in this microbial gang? You've got your usual suspects like strep and staph, but there's one particularly nasty one, Echinella corrodens, that shows up in almost a third of these cases. And this bug is notorious for causing really serious infections in tissue and even bone.
Okay, so since this is so dangerous, you've got to know what to look for, right? Let's walk through how this thing goes from what looks like nothing to a total crisis.
In the beginning, signs are pretty much what you'd expect from any infection. The pain doesn't get better, it gets worse. The area gets swollen, red, and warm. But here's the major red flag. If it hurts when you just try to gently move the finger or joint, that's a big clue the infection is already deep inside the joint itself.
And here's the kicker. The real problem is just human nature. Because the cut looks so small, and maybe because of how the injury happened in the first place, people tend to put off getting help. They just wait and see, usually until the pain and swelling are totally unbearable.
And by that point, the infection is often way worse. You might start seeing signs that it's spreading through your whole body, like getting a fever or the chills. And of course, if you see any pus coming from the wound, well, that's a clear sign things have gotten very serious.
So this all leads to one absolutely critical, non-negotiable point. You have to get medical help, and you have to get it immediately. This is not something you can just wait and see on. It's a race against infection.
And look, don't just take my word for it. Let's check out the official guidelines from a major authority on this stuff, the British Society for Surgery of the Hand. Their standards are about as clear as it gets. For a fight bite, they say urgent surgical exploration is, and I'm quoting here, mandatory. Not a good idea, not recommended, mandatory. Why? Because the risk of getting septic arthritis, which can completely destroy the joint, is just way too high.
So, what does this mandatory treatment actually look like? Well, it's not just getting a bandage and some pills. It starts with surgery. They have to open the wound back up, completely flush out the joint, and cut away any tissue that's already infected. That's followed by powerful IV antibiotics while you're in the hospital, and then you go home with a course of oral antibiotics. It's a serious response to a very serious infection.
And why all this urgency? Because when we talk about waiting versus acting fast, we're talking about two completely different outcomes. The stakes are incredibly high.
If you get it treated right away, the results are usually pretty good. They get the infection under control, and you can save the function of your hand and finger. But if treatment is delayed, the consequences can be absolutely devastating. We're talking septic arthritis that ruins the joint, osteomyelitis, that's an infection in the bone, permanent stiffness and pain, losing the ability to use your finger, and in the worst case scenarios, even amputation.
So we end up right back where we started, with a tiny, innocent-looking cut on a knuckle. But now you know what's really going on, what's potentially sealed deep inside that joint thanks to that little trapdoor. Knowing what's really at stake
Is that a chance anyone should be willing to take?